of us speaking today is to provide basic background knowledge about the alliance of the dermatologic structures, our patients who are on targeted therapy, and the nursing process. Oncology nurses play a key role in the research and patient education related to skin toxicities. We must be comfortable in communication, referring at the appropriate times for certain situations, educate our peers, patients, and their families on these side effects, encourage our patients through their time of need, perform meticulous, accurate assessments of the skin, deliver appropriate patient-specific interventions, and manage and minimize side effects of the skin, allowing the patient to continue treatment uninterrupted. We must look at the holistic picture when managing these patients, as there are a multitude of effects resulting from dermatologic reactions induced by anti-cancer therapy, such as non-adherence of treatment, negative impact on quality of life, financial burden, psychosocial impact, impact on physical health, impact on instrumental and self-care activities of daily living, and can be a stressor on the family. We know that 8% of patients on EGFR inhibitors are referred to a dermatologist for cutaneous toxicities. This statistic illustrates that there may be an unintentional divide in the world of oncodermatology, and it's part of our job to help fill that gap. This may also elucidate the need to establish a referral system with healthcare providers who work in, but not limited to, wound care, oral health, dermatologists that specialize in contact or systemic allergy testing, rehabilitation for lymphedema therapy, pain and palliative care, psychiatry, geriatrics, smoking cessation, social work, case management, financial resources, specialized resources for the older patient, support programs, and also patient activities in the hospital. An oncology nurse should have an understanding of the integumentary system, be very well trained in the management of cutaneous side effects, and should appreciate our vital role we play when it comes to patients receiving treatment. There was an interesting study that investigated the patient and provider's perception of the certain roles in chronic dermatologic treatment. The nurse was characterized as the treatment coach who provided individualized advice based on the analysis of each clinical situation. Another noteworthy mention is that the nurse was perceived to be more accessible via telephone and have a deeper understanding of the patient's situation. Although this information is widely known, this is an important study as it highlights that nurses are on the front line, just like our skin is the body's first line of defense. We know that health promotion by nurses can lead to many positive health outcomes, including adherence, quality of life, patients' knowledge of their illness, and self-management.